For those that don't know me, as Eddie said, my name is Jo Matthews. I'm the Associate Director of Improvement and Safety within Healthcare Improvement Scotland, and I'm also the Head of the Scottish Patient Safety Programme. Today is not only an opportunity to share, learn and celebrate and build on the work that we have been delivering to improve the quality and safety of care across Scotland, but also to reaffirm and ground us in the importance of why this work matters at all levels of the system, from patients, carers, family, you and your teams, your organisations and the system as a whole. So to ground us in this work, we have to go back to the why. And it's always about starting with the why. Why does this remain as important now as it did when we launched the programme some 15 years ago? But also, why does this matter to you? What's driven you to be here today? And much of that why remains as true now as it did back in 400 BC when we think about Hippocrates. The vast majority of us come to work, the vast majority of people come to work to do the very best they can. But achieving this in reality is really challenging, and what you will have been experiencing over the last 2 to 3 years, as Ezzy's described, will reflect that. Last month, I marked my 10th anniversary as leading SPSP, and my goodness, how the world has changed. The context, the complexity of the systems, the range of methods, and the people have all changed. But that mirrors the nature of safety itself, dynamic and continually evolving. There's no doubt the pandemic has presented significant challenges for health and care and brought a renewed focus to a range of existing safety issues, but also highlighted and added new ones. It has highlighted the challenge of sustaining care right down to the bare essentials. Despite everybody's best efforts, harm continues to happen to those receiving care and to those delivering care. The context in which our systems has changed, and I'm sure each of us here today would agree, the work of safety is not done. There's a clear need to build on past gains, nurture innovations and embed those improvements. So now, as we operate within this new context that we're all working within, the conditions for improving and maintaining safety remain a national priority. And that's where the work of SPSP continues to play an important role, bringing people together around a common purpose and a shared goal to improving the safety of care for all, supporting people to apply quality improvement methods to key safety issues that have been identified by you and owned by you and within the system. Work that is of value and of meaning, not only necessary to improve the safety of care, but also important for those at the heart of those changes. People like you and your teams coming together, being part of something that affects long-lasting positive change, bringing purpose and joy in the midst of what we have heard and seen can feel at times utterly overwhelming. That takes courage, commitment and collaboration, all in the pursuit of this aim. The foundation of all this work rests within the essentials of safe care, and without these, our ability to affect and sustain the improvements of which you're going to hear a lot about over the course of today cannot be achieved. For those learning about the essentials for the first time today, you'll be able to access the interactive driver diagram within your virtual delegate bag. And absolutely, we have moved from those canvas bags to that delegate bag now. The 4 primary drivers reflect the key essentials that underpin the delivery of safe care. What rests behind each of those secondaries is the rationale for why these are important, what is already expected of us in delivering that care, and a range of resources and tools, including readiness assessments, prioritisation tools, and measurement for everybody to access and help you on your improvement journey. As you will see through the breakout sessions today, the essentials has been weaved through the improvement work to ensure we're building a systematic approach. However, embedding these conditions as an organisation and system-wide level will require constancy of focus. And now, the how has been as important as the what. And for Scotland, whilst a range of improvement methods now exist to support redesign and continuous improvement, the IHI's model for improvement remains our go-to for SPSP. From understanding what we're trying to achieve, through to developing those theories of change, measuring and capturing progress, and learning through iterative cycles of testing. And I appreciate for those who have been part of the SPSP family, this will be second nature in your approach locally. But as I mentioned at the start, there are many people joining us today for the first time. And through the course of today's sessions, you will hear from teams about the iterative process in action. Not easy, can take time, however fosters innovative approaches, continuous learning and adaptation. Last September, the Health Foundation published its evaluation and key learning on a partnership between Virginia Mason and 5 NHS trusts in England. And they were trying to build cultures of continuous improvement within their organisations. The report identified key recommendations for both local and national systems, and really to support that effective organisational whole improvement. The evaluation found a strong culture of peer learning and knowledge sharing as a critical enabler for those organisations' wide improvement. And that's where SPSP can create the conditions in which that knowledge, experience, learning can facilitate and accelerate change and improvement and can be shared across health and care. Throughout this learning session, you can connect with teams working on similar safety issues as yourselves. None of the work of SPSP would happen without you or your teams. And the SPSP learning system continues to support the opportunities to share learning and improvement work right across Scotland and also beyond. We continue to do this through a range of ways, including sessions such as today's case studies, data, and being able to be at the beating heart of the system, the networks that you are within. So you've heard about the why, the what, and the how. What can you do? We all come here today with a circle of control in which we can make that change happen. We have a circle of influence in which we can support others to make that change happen. And yes, there's that circle of concern that often is a lot of noise. But really, I would ask you throughout the course of today to take a moment to think about, what can I take from today back to my organisation that I can change? What can I take back that I need to help others and influence them to make that change? Because just imagine, if we all do that, we can collectively achieve this aim. Thank you very much.